أعزائي طلبة المرحلة الرابعة كلية الطب، أنا وياكم بروفيسور عبد الرزاق سلمان، Consultant Urologist, College of Medicine, University of Babylon. Our lecture today about the penis and the scrotum. Learning objectives for this lecture to recognize and understand the following. First, the common disease of the penis and the principles of their management. And also include with this imperfect testicular descent and appreciate the main indications for intervention. Testicular torsion as an urological emergency, the principles of the management of varicocele, hydrocele, and epididymal cyst, the classification and management of testicular tumors, and the last, the treatment options for infertile men. Today, our talk about the common disease of the penis and the principles of their management. The first of all, we talk about the phimosis. This is what we call, or due to narrowing of the opening of the foreskin, so that cannot be retracted. The physiological adhesions between the foreskin and the glans penis may persist until 6 years of age or more, giving the false impression that the prepuce will not retract. This condition should not be confused with the true phimosis. This is what we call physiological phimosis. While the true phimosis in boys, which is associated with the scarring of the prepuce, which will not retract without fissuring. In these cases, the aperture of the prepuce may be so tight as to cause urinary obstruction. Phimosis occurs as a result of panis xerotica obliterans. Regarding the panis xerotica obliterans, it is a curious condition in which the foreskin becomes thickened and will not retract. What are the complications of the phimosis? It is difficult to keep the penis clean because, as you know, covering of the glans by the foreskin and cannot be retracted, and there is both a problem with hygiene, and in later life there is a high chance for to develop carcinoma. The treatment, definite treatment, is by circumcision. What mean of the circumcision? It is the most commonly performed for cultural reasons, for social and religious reasons. Medical indications, this is include when there is true phimosis with palaenopostitis, an infection of the prepuce of the foreskin and the glans, or obstruction to the urinary flow, and recurrent urinary tract infections. In adults, circumcision is indicated because of the inability to retract for intercourse, for splitting, for an abnormally tight frenum, for palanitis, and sometimes before radiotherapy in case of carcinoma of the penis. Technique of the circumcision in infants, applying either clamp or bone forceps across the prepuce distal to the glans with a blind division of the foreskin, and is to be condemned to see one boy with partial or total amputation of the glans is enough to realize the folly of this technique. It is far better to perform a proper circumcision under direct vision as an adult for the safety to injury of the glans. Also, very important point, never use monopolar diathermy when performing circumcision. Other subject, what we call penile injuries. This is, first of all, avulsion of the skin of the penis, entanglement of clothing, and the rotating machinery is the usual cause. Also, fracture of the penis. This is other condition in which it is not common. It is uncommon accident usually occurring when the erect penis is bent violently downwards during intercourse. There is extravasation of the blood, causes great pain and swelling of the penis. In the early cases, incision and drainage of the clot with the suture of the defect in the tunica of the ruptured corpus gives acceptable results. To keep the erection later on. Also, strangulation of the penis by rings placed on the penis, usually for sexual reasons, can cause venous incorporement, which prevents their removal. It may help to aspirate the corpora cavernosa. But often the ring must be cut off with a ring cutter or hacksaw. Other condition, what we call it paraphimosis. This is a tight foreskin. Once retracted, may be difficult to return to normal position. In this condition, the venous and lymphatic return from the glands and distal foreskin is obstructed and these structures swollen. So difficult to return to the normal, causing even more pressure within the obstructed ring for the prognose. And definitely this will impair with lymphatic and blood vessels. Treatment by first conservative ice packs, gentle manual compression for a while, and injection of solutions of hyaluronidase in normal saline may help to reduce the swelling. Such patient can be treated by circumcision if careful manipulation fails. Sometimes we use dorsal slit for the prepuce, and the local anesthesia may be enough in emergency cases. Inflammations of the penis, this include either posthitis and balanitis and palanopostitis. Posthitis, this is inflammation of the prepuce, is known as posthitis. While inflammation of the glands, this is what we call it balanitis. If the inflammation involve both, the glands and the prepuce, this is what we call it palanopostitis. The skin conditions of the penis, skin pathology or diseases such as lichen planus, psoriasis, affect the penis and indeed may be localized there. Also, one of the manifestations of drug hypersensitivity reactions can be seen on the skin of the penis. In more severe inflammation, the glands and foreskin become red, raw, and there is pus discharge, pus exudate. Palanopostitis is associated with penile cancer, diabetes, and phimosis. Also, moneural infections are quite common under the prepuce. The treatment definitely by broad spectrum antibiotics and local hygiene. Other condition, what we call it cordy. What's mean of cordy? Cordy, this is a fixed bone of the penis caused by hypospadias or more rarely chronic urethritis. Erection of the penis is deformed and sexual intercourse may be impossible. So the treatment in this condition needs surgical correction. Other condition, what we call it Peyronie's disease. What's mean of Peyronie's disease is a relatively common cause of deformity of the erect penis. On examination, we found there is hard blocks of fibrosis can usually be palpated in the tunica of one or both corpora cavernosa. The blocks may be calcified. The etiology of this condition is unknown or uncertain. How to treat? Treatment is difficult. Medical treatment are often ineffective. Some cases continue to progress when the deformity of the penis is causing distress. Prevent the coitus or interruption or penetration of the penis. So surgery may be indicated to correct the deformity that interferes with the sexual function. Other condition, what we call persistent priapism. The penis remains erect and becomes painful. This is a pathological erection, and the glans penis and the corpus spongiosum are not involved. Usually seen as a complication of a blood disorder such as sickle cell anemia or sickle cell disease, or in case of leukemia. However, it can sometimes follow therapeutic injection of papaverine or even an abnormally prolonged period of otherwise normal sexual activity. A tiny proportion is caused by malignant disease in the corpora cavernosa or the pelvis. Priapism is rarely seen as a consequence of spinal cord disease. how the treatment or the persistent periodism should be dealt with the underlying cause, and then if aspiration of the sludged blood in the corpora cavernosum fails to cause detumescence, and repeated injections of metaraminol or 1/1000 adrenaline epinephrine solution is ineffective, it may be necessary to go for other surgical intervention in form of anastomosis between the corpus spongiosum and corpus cavernosum. I mean, redirect the blood for detumescence. Other condition, this is what we carcinoma of the penis. Carcinoma of the penis etiology, as we know, circumcision soon after the birth confers immunity against carcinoma of the penis. Later circumcision does not seem to have the same effect as when we did earlier circumcision. The chronic pyelonephritis is known to be a contributory factor, and there are definite precancerous status like leukoplakia of the glands, long-standing genital warts, which may rarely be site of the malignant changes. Paget disease of the penis is a persistent roundness of the glands, like long-standing balanitis followed by cancer of the penis. Treatment is by circumcision. Observation and excision of the lesion does not resolve. If it does not resolve, we surgical excision. Okay. Pathology, carcinoma of the penis may be flat and infiltrating or papillary, according to the type. The former, I mean the flat one, often starts as leukoplakia, and the later results from, and the later here papillary from existing from an exist papilloma and change to the carcinoma. Local growth continues for months or years. The earliest lymphatic spread of this lesion is to the inguinal and then to the iliac nodes. Distant metastasis deposits are infrequent in case of carcinoma of the penis. Clinical features of the carcinoma of the penis: about 40% of the patients are under 40 years of age. Mild discomfort and light discharge are often neglected, and the disease progresses slowly. By the time of the patient present, the growth is often large, and secondary infection causes of all bloody discharge. There is little or no pain. In total, 60% present with inguinal lymph node enlargement, but in half of these, this is caused by sepsis. So a biopsy should be performed to make the diagnosis. Later, the inguinal node erode the skin of the groin, and the death of the patient may result from erosion of the femoral or external iliac artery. How to treat the patient with carcinoma of penis? Radiotherapy is effective in 60 to 70%, I mean high percent, survival rate at 4 years. For small cancers, circumcision precedes the treatment. This will facilitate the exposure of the area to the radiotherapy. Surgery is for large anaplastic growths. If there is infiltration of the shaft and when radiotherapy fails, partial amputation is used. When in advance and involve all the penis, total amputation is necessary. Also, there is possibility of secondary cancer for the penis as a result of spread from the primary tumors of the bladder, scrotum, or prostate, and this is uncommon. Sexual transmitted disease. This is what we call it. Genital herpes is caused by sexual transmission of the herpes virus hominis type 2, congenital type 1. Recurrent attacks occur in 50% or more of cases. Pain along the distribution of the sensory nerve, usually genitofemoral, precede the eruption by 2 days and may be particularly severe around the anus. A group of tiny vesicles rapidly erodes to form shallow, yellow, or red-based ulcers. In female patients, the ulcers often spread onto the thighs during the attack. Involvement of the urethra by the genital part may cause retention of the urine, which may persist for up to 14 days if there is radiculitis of the S2 and S3 nerve roots. A treatment by acyclovir, this is antiviral, has been shown to be effective in the treatment of the genital warts, but it does not prevent the recurrence. Lymphogranuloma venereum is a sexually transmitted tropical disease caused by Chlamydia trachomatis. The primary lesion is a fleeting, painless genital papules or ulcer, often unnoticed by the patient. The inguinal glands becomes enlarged and painful in both sexes between 2 weeks and 4 months after infection. The masses of the nodes marked together above and below the inguinal ligament to give the sign of the groove. The overlying skin readiness, and there may be fluctuation. In women, there may be a proctitis, which can go on to produce a rectal stricture if untreated. Lymphatic obstruction leads to the lymphedema in the perineum and occasionally the lower limbs. Urethritis and urethral strictures occur in men. Diagnosis confirmed by the isolated chlamydia from the lesion and by immunological test to detect antibodies against the organism. Treatment, a combination of antibiotics which may include sulfonamide, oxytetracycline, cycline, and erythromycin. Other condition, what we call it condylomata acuminata. This is what we call genital warts. Genital warts are caused by infection with the human papilloma virus and are sexually transmitted. The lesion most commonly occur under the prepuce in the coronal sulcus, but may be found elsewhere, including inside the urinary meatus. In women, genital warts are most commonly found on the vulva, but they may line the vagina and occurs on the cervix. Perianal warts are common. Other associated sexually transmitted disease should be excluded. In women, mainly candidiasis and trichomonas infection, and in men, syphilis or gonorrhea. Genital warts may be complicated to human immunodeficiency virus infection. Thank you very much for your attention.